syndrome is the genetic disorder that is caused when there is an additional chromosome in a person's genetic material, meaning they have 47 chromosomes in their cells instead of the usual 46. The additional chromosome occurs on chromosome 21, which is why Down syndrome is sometimes referred to as trisomy 21. Occurring at conception, Down syndrome can affect both genders, no matter their race, ethnicity, or parents' age. While many children with Down syndrome are enrolled in schools catered to teaching children with learning disabilities, research has shown that students with Down syndrome are more likely to succeed in mainstream schools where inclusion is embraced and encouraged. Due to this, it is crucial that schools and teachers continue to adopt and improve policies and practices that advocate for inclusive education. The ability to move and carry out tasks is essential to human development, with many being essential to succeeding throughout life. These abilities, or motor skills, generally begin development during childhood, but often progress in difficulty and specialization throughout adult life. Most young children with Down syndrome are slow at achieving early motor skills such as standing, walking, grasping, and rolling. However, this does vary between children, as some achieve these tasks at the same rate as normally developing children, while others are particularly slow. Motor development for children and students with Down syndrome is significantly delayed when compared to students progressing at a normal rate. However, all basic motor skills are eventually achieved and in the same order as observed in typically developing children. While these children do achieve basic motor skills, their refinement of these skills will not be at the same level as typical children, and their movements will often appear clumsy. Furthermore, most children with Down syndrome will suffer from physical differences, such as hypotonia and lax ligaments. These symptoms lead to children with Down syndrome having poor muscle tone, leading them to be presented as floppy or flaccid. Some children do eventually lose this state as they continue to develop, but for others, this situation does not improve over time, and they require additional support when taking part in physical activities. Children with Down syndrome also suffer from a reduced size of the cerebrum, as well as maturation disorders which further discourage development. Children with Down syndrome also display less muscle strength when compared to similarly aged students. However, it is unclear whether this is a direct effect of hypotonia and lax ligaments, or instead due to children with Down syndrome not being able to participate in active movement, and thus are not able to increase their muscle strength. Either way, Down syndrome is still the cause behind limiting motor development in this area. Children with Down syndrome also display slower reaction and movement times. Motor skills such as standing and walking are also achieved at a far later stage in children with Down syndrome than typical children. While most typical babies begin walking between 12 and 16 months, children with Down syndrome do not generally achieve this skill until they reach ages 3 to 4. Children with Down syndrome struggle with this task due to utilizing the flexor and extensor of the human trunk, which is affected by symptoms such as muscle hypotonia and lax ligaments. Low muscle tone and poor balance caused by a smaller cerebellum alongside increased energy costs lead to further delays in walking. These delays in motor skills not only influence a child's ability to operate physically, but also impacts their ability to explore the world and their environment independently. Furthermore, delays in these skills affect cognitive and social development due to a decrease in stimulus, which results in a child and eventual adult with decreased independence. While in some cases, children with Down syndrome do not succeed in developing all motor skills, the difference between Down syndrome children and children that are developing at a typical rate is that the development of motor skills is delayed rather than different. Children with Down syndrome may require longer and more time to practice certain skills and movements. Most will develop everyday motor skills and some fine motor skills to a competent level. While many will continue to struggle with skills involving balance and with the possible presence of lax ligaments and hypotonia, children with Down syndrome will succeed in the development of their motor skills through the support of time, additional physical and cognitive support, as well as their peers.
When looking at the dynamic systems theory, we have to look at how Down syndrome will influence the growth of someone affected. Growth not only meaning physical, but mental, and how these are environmentally influenced. Before looking into the dynamic systems theory, we must know and understand what Down syndrome is in relation. An explanation has been given by Gabbard, as Down syndrome is caused by the presence of an extra chromosome in the 21st pair of chromosomes. We know this. However, we must note that people born with Down syndrome may have retarded mental and motor development, heart defects, short hands and feet, and distinctively abnormal facial features. These defects will influence someone throughout their life, often meaning that someone who is affected will have slower decision making and slower information processing. They are also at risk of heart problems, which will limit abilities, especially in sport. A person with Down syndrome will also lack connections with their mind and muscle, even lacking strength and even having slower reaction times than a normal student. As a teacher, this will pose many challenges. It is explained that teachers might expect that the performance and motor learning of motor skills would be specifically impaired in this particular group, as explained by Frith and Frith. They will be subject to slower development of motor skills and reactions, specifically tapping and arm movements. When looking into the dynamic system theory, it would be evident that due to limited development, they will have a slower and overall lack of physical growth and neurological maturation. When coming into a physical education standpoint, they will have more rate limiters on the same task. The dynamic systems theory helps one understand why someone who suffers from Down syndrome may struggle, where they will struggle, and where they can be aided, allowing for development. One of the main struggles for the educator, and even the students, will come from their lack of motor development and slower neurological pathways. When it comes to teaching for games and understanding, this form of learner-orientated tasks and teaching game-like situations may act as a constraint. When it comes to the dynamic systems theory and teaching games for understanding, it is using the known information of how the resources are hierarchical. One will understand how it can be applied and used. For someone suffering from Down syndrome, they will face more rate limiters on the individual level, meaning that for one to complete a task, adjustments in the environment and the task will have to be made and considered. Knowing this, and knowing that some tasks are harder to learn, tasks such as tracking are harder for people suffering Down syndrome to keep in time with the target, showing that this group would struggle to follow targets and struggle with throwing and catching. In tasks such as tapping rapidly, Down syndrome children were slower and more erratic, meaning anything rhythmic and constant such as running they will struggle with. Knowing this will help analyse where the group struggles and how it can be aided in teaching and development. Looking into the group's development and improving skill, knowing where someone with Down syndrome struggles will help, but also accommodations and help that will overcome the rate limiters. As majority of the rate limiters are lacks in individual ability, as stated, the accommodations will come from the environment and task. For example, knowing someone that suffers from Down syndrome struggles with tracking or tapping or hand movement, to teach and better a task such as catching, one will have to change the environment by changing the colour or size of ball and making it easy to catch. Also change the task. Instead of catching the ball from 10 meters, maybe catching the ball from 3 will help. Or in other classroom cases such as writing, they will lack the ability to follow reading and then write. Another issue is passivity, also affects processing speeds. So lack of attentiveness may also be a rate limiter due to the disability and not understanding what to do. Say a child with Down syndrome is learning to throw a ball. To make the task achievable and engaging to develop the skill, the goal of the movement will have to be simplified and attainable. Use less muscle and maybe a shorter distance so the learner can achieve self-organisation, have a smaller transition period and less rate limiters, making the task harder. An example would be normal students throwing a ball as far up as they can uphill to understand flight paths. A student with Down syndrome may only need to learn how to throw the ball as accurate over a short distance on a flat surface to see what a ball in flight looks like. The main way of aiding development is to let them learn, but make the activity easier, using the dynamic systems theory to better their abilities and development. By understanding the group and what limits their development, a teacher will be able to see where needs help and what can be done. Instead of making everything as easy as possible, giving a person with Down syndrome opportunities will aid them in life and allow them to develop motor skills the best that they can.
Inclusivity is the most predominant aspect in classroom learning for students with Down syndrome. All practical learning and teaching applications must exemplify inclusive practices, as students have a flexible and regularly adjusted classroom environment to ensure diverse learning. Down Syndrome Australia have provided the education system with a virtual toolkit to assist teachers and educators with the appropriate resources for developing a better understanding of inclusive education, and what adjustments, both academic and social, can be made to support the participation of all. This inclusion in recognizing that no two learners benefit from the same generic patterns. Students should be offered opportunities to learn, participate, and be assessed in various ways. For example, within a HPE class, students could be participating in a throwing and catching unit, but the task could be adjusted to provide appropriate differentiation for students with a disability, such as Down syndrome. Differentiation being throwing length, ball size, weight, and adjusted technique. This ensuring everyone is participating and respecting diversity, regardless of skills and ability. As enforced by the Disability Standards for Education 2005, reasonable adjustments must be asserted into the classroom environment to support students with Down syndrome. The adjustments include providing lesson information in an array of oral and visual ways, modifying lesson content, accessibility, modifying assessment task difficulties, and providing more time for assessments to be completed and submitted. When applying teaching and learning implications for students with Down syndrome, it is important to understand the individual's educational requirements, as these particular students are homogeneous in their learning needs. However, there are a range of strategies proven to be effective for many learners with Down syndrome, as stated by DSA, including using visual support techniques of creative diagrams and video representations. Students may require physical assistance, as some students with Down syndrome struggle with posture support. Enlarging electronic documents due to visual accuracy may be diminished, and providing executive functioning by supporting the breakdown of tasks into smaller steps to assist with memory input and monitoring the completion of the task. The term least restrictive environment, or LRE, is commonly practiced to help determine the most appropriate settings offering the best opportunity for educational advancement for a student with a disability. The LRE within physical education is wary of change, as it is dependent on unit instructions and physical surroundings. Furthermore, physical education teachers need to assert adaptive teaching styles, providing continuous evaluation and modification of environments to determine the most appropriate LRE for students with disabilities. Student segregation should always be a backseated idea. However, if the segregation is in the student's best interests, it could be used as an affordance to their learning. Student segregation classes are intended to establish a level of skill and social proficiency that will eventually enable the special student to be transferred to a less restricted learning environment. Again, the goal of the process is to place students in the LRE that offers them the most benefit. Another approach to physical education learning for students with Down syndrome is an individualized education program, IEP. The IEP identifies the student's special qualities and determines educationally relevant strengths and weaknesses. A plan is then devised based off the diagnosed strengths and weaknesses. The IEP should consider the most appropriate accommodations and modifications to that specific child's learning. The procedure for effective assessment with a physical education classroom is likely to be approached to perform both screening and more formal evaluations of students during the child find process. Furthermore, providing that all physical education teachers must convey the knowledge and skills in appropriate assessment tools and protocol. The internationally celebrated Lots of Socks fundraiser on March 21st raises global awareness towards World Down Syndrome Day. The simple yet creative organisation uses quirky socks as conversation starters about diversity, uniqueness, inclusion, and acceptance, promoting the idea that socks are all types, shapes, sizes of the same thing, which can be unique in their own way and yet do the same thing. Children understand what socks are, how they look, and what they are for, and children understand that no two socks are the same. The Awareness Act is cemented into the primary school setting, assisting in developing social and educational inclusion of children with Down syndrome in their school community.